Welcome back to the deep dive. Today, we're really digging into something that, well, it impacts every single one of us every single night, or, we hope it does. We're talking about sleep.
Ah, yes, sleep. So essential, and yet so often tricky.
Exactly. And you've given us a really fascinating set of sources here. It looks like we're covering everything from the deep biology, what's actually happening when we sleep,
Right, the mechanics of it.
to the practical side, like how to actually get to sleep faster, and the pretty big impact sleep has on our health overall.
It really is far more critical than I think most people give it credit for. It's not just downtime.
So our mission, as always, is to unpack these sources together, pull out the really key insights for you so you walk away feeling hopefully well-informed, maybe even with a couple of new ideas for getting better rest.
Sounds good.
Let's start with what feels like the most basic question, but maybe isn't so simple. Why do we actually need sleep in the first place?
Well, the sources are really clear on this. Sleep is absolutely fundamental. It's essential for the body, for the brain, just to function properly. It's not optional.
Okay, so it's not just like hitting pause. There's actual work being done.
Precisely. Think of it as critical recovery time. During sleep, yeah, your brain and body slow down on the surface, but underneath, there's vital maintenance going on. This isn't just about feeling okay the next day.
Right.
It's really fundamental for long-term physical health, mental health, the works.
Right. Is there like a magic number? How much of this maintenance do we typically need?
The general guidance, looking across the sources, is pretty consistent. For adults, the aim is usually somewhere between 7 and 9 hours a night.
7 to 9, okay.
Yeah, though children and teenagers, naturally, they need quite a bit more.
Okay, so if that's what we need, what happens when we, consistently don't get it? What are the consequences the sources point to?
Yeah, that's where things get pretty serious pretty quickly. The sources detail a whole cascade of negative effects. Just day to day, you're looking at things like constant fatigue, feeling restless, being more irritable.
That irritability one definitely rings a bell for many, I'm sure.
Oh, absolutely. But it goes way beyond just feeling a bit grumpy. Your actual performance takes a nosedive.
How so?
Things like concentration, memory, your ability to learn new things, make decisions, all of that gets significantly worse. Reaction times slow down too, which is a big one for, accidents.
That makes total sense. Your brain's just not firing on all cylinders.
Exactly. And then there's the longer-term picture. The sources highlight increased risks for mental health issues. Things like depression and anxiety are strongly linked.
Wow.
And physically, too. Insufficient sleep is tied to a higher risk of really serious conditions. We're talking heart disease, diabetes, obesity.
So it's not just feeling foggy, it's actually increasing your risk for major chronic diseases down the line.
Precisely. And it can even mess with your sleep cycles themselves. One source mentions that being sleep deprived can lead to something called REM sleep rebound later on.
What's that?
It's where your brain tries to catch up on lost REM sleep, but it spends too much time in that really active state, which can actually make you feel even more irritable or less rested.
Huh. So even trying to catch up can backfire sometimes.
In a way, yes. And while it's rare, one source does point out that some very severe sleep disorders can actually be life-threatening.
Okay. So the takeaway is pretty stark. From brain fog right now to potentially serious health issues later, sleep is just crucial. So to get why it's so powerful, we need to look inside and what's actually going on. It's not just one state of being off.
Not at all. The sources talk about sleep having a complex architecture. It's not uniform, it's dynamic. You cycle through different stages all night long.
Okay, walk us through this architecture. What are the stages?
Right, so generally we talk about 4 main stages within a cycle. You start with stage 1 that's really light, just drifting off, easily woken.
That sort of head nodding phase.
Exactly. Then you move into stage 2. Here, you're settling down more, body temperature drops a bit, brain waves slow down, although you still get these little bursts of activity. These first 2 are lighter, non-REM sleep stages.
Okay, and then it gets deeper.
Yes, stage 3. This is what we often call deep sleep or slow wave sleep, SWS. This is really the prime time for physical restoration. Brain waves are very slow, heart rate and breathing are at their lowest, muscles are totally relaxed. One source specifically highlights this stage, SWS, as a marker of your sleep pressure, basically how much your body needs sleep.
Ah, so the more SWS you get, the more sleep debt you were paying off, so to speak.
Yeah, you can think of it like that, yeah. And then comes the 4th stage. REM sleep, rapid eye movement.
The dreaming stage.
That's the one most famous for vivid dreams, yes. And it's fundamentally different from those first 3 stages.
How is it different?
Well, for one thing, your brain activity actually skyrockets. It looks surprisingly similar to when you're awake on an EEG. Yeah. Breathing and heart rate pickup can become irregular. But here's the really fascinating part. Most of your muscles become paralyzed.
Right, so you don't, like, jump out of bed acting out a dream.
Exactly. It's called atonia, a natural safety mechanism. Your eye muscles are the main exception, hence the rapid eye movements. And REM is thought to be really important for cognitive stuff, like locking in memories, processing emotions.
So you cycle through all four of these stages. You don't just hit deep sleep and stay there.
Correct. A full cycle through stages 1, 2, 3. And then REM usually takes about, anywhere from 70 to 120 minutes. And you'll typically go through 4 or 5 of these cycles a night.
And is the pattern the same all night?
Not quite. You tend to get more of that deep, slow-wave sleep in the first half of the night, and then the REM periods get longer and more frequent in the second half. So a really orchestrated biological dance.
And this dance involves hormones too, right? Chemical messenger.
Absolutely. Sleep is critical for regulating a whole bunch of hormones. Melatonin, obviously, the darkness signal, but also growth hormone, which is vital for repair, cortisol, the stress hormone, even hormones that control your appetite, like leptin and ghrelin. It's a key time for keeping your body chemistry balanced.
Given all this complexity, all this essential work, it's probably not surprising that so many people struggle with sleep.
Unfortunately, yeah, it's incredibly common. One source mentioned, I think, over 50 million people in the U.S. alone have a chronic sleep disorder. And that's not even counting everyone who just feels like they don't get enough sleep.
50 million, that's just a staggering number. What kinds of specific problems are we talking about, according to the sources?
Well, the sources list several major categories. Things like insomnia, obviously trouble falling or staying asleep, sleep-related breathing disorders like sleep apnea.
Where you stop breathing.
Right. Then there are disorders of hypersomnolence, meaning excessive sleepiness like narcolepsy, circadian rhythm disorders where your body clock is just out of sync, parasomnias, which are those weird behaviors during sleep like sleepwalking or night terrors, and sleep-related movement disorders like restless leg syndrome.
So lots of specific conditions under those umbrellas. What are some common symptoms people might experience?
It really varies. Difficulty falling asleep or waking up frequently, obviously.
Right.
Loud snoring, gasping, or choking sounds during sleep. Big signs of apnea. That uncontrollable urge to move your legs when resting, for RLS. Or even feeling, paralyzed for a moment when you wake up.
And what's causing all these issues? Is it just stress?
It can be a lot of things. Underlying medical conditions, mental health issues like anxiety or depression. Sometimes it's genetic. Certain medications can interfere with sleep. Lifestyle factors are huge. Shift work is a big one, using caffeine or alcohol too close to bed. Sometimes it's related to low levels of certain brain chemicals, or, frustratingly, sometimes the exact cause isn't clear.
Are some people more at risk than others?
Yeah, the sources point to factors like having other health conditions, high stress levels, working late shifts, a family history of sleep problems. Interestingly, being female and being over 65 are also associated with higher risk for some disorders.
And there's that weird catch-22 you mentioned earlier, the harder you try to sleep.
Oh, absolutely. One source really highlighted that. Stressing about not sleeping creates this anxious energy. Your mind is racing, telling yourself, I must sleep now, and your body just rebels. It's like performance anxiety for sleep, and it keeps you wide awake.
So frustrating. Okay, we get why sleep is vital, what happens inside, the common struggles. Let's switch gears to the practical side. What can people actually do when sleep just isn't coming? What techniques do the sources suggest?
Right, so one source in particular, Healthline, goes through several specific methods. It does preface this by saying, the foundations like good sleep hygiene, which we should definitely cover, are crucial, but sometimes you need a targeted technique for that moment.
Okay, let's hear them. What about this military method? Sounds intense. Claim sleep in 10 seconds.
Yeah, it sounds almost too good to be true. The source traces it back to a book about training WWII pilots, claiming it helped them fall asleep super fast, even with distractions. But the source is very careful to point out there's basically no solid scientific research backing up that 10-second claim. And the method itself actually takes about 2 minutes to do. The 10 seconds seems to refer to the final mental clearing part.
Okay. Less magic, more process. What's involved?
It's essentially a full-body relaxation scan. You consciously relax your face muscles, jaw, tongue, around the eyes, then let your shoulders drop, hands go limp. Exhale, relax your chest, then focus on relaxing your legs from thighs down to calves and feet.
And the mental part that takes 10 seconds.
Once your body is relaxed, you try to clear your mind for 10 seconds. Either picture a really calming scene like lying in a canoe on a calm lake, or if your mind keeps wandering, repeat the phrase, don't think, for 10 seconds. The idea is, with the body relaxed and mind clear, sleep should follow quickly.
Sounds like it relies on fundamental relaxation skills.
Exactly. And the source notes, it might be tougher for people with conditions like ADHD or anxiety, where racing thoughts are a major issue.
Okay, what about techniques aiming for, say, around a minute? A bit more realistic, maybe.
Yes, the source groups a couple under the 60-second banner, though it notes beginners might take up to 2 minutes. These focus on quieting the mind by turning focus inward.
Like breathing exercises. I think I saw the 4-7-8 method mentioned.
That's the one. Developed by Dr. Andrew Weil, based on yogic breathing, pranayama. You put your tongue tip just behind your upper front teeth. Exhale completely through your mouth, making a whoosh sound.
Okay.
Then close your mouth. Inhale quietly through your nose for a count of 4. Hold your breath for a count of 7. The source says this hold is the most important part. Then exhale fully through your mouth, again with a whoosh, for a count of 8.
And you repeat that.
Yes, you repeat the whole cycle 4 times. It's meant to be calming, almost trance-inducing for some, though again, a caution for people with respiratory issues.
Makes sense. What's the other 60-second-ish technique?
Progressive muscle relaxation, or PMR. This is a classic. The idea is you systematically tense, then release different muscle groups to learn what relaxation feels like and let go of physical tension.
How does that work in practice?
You'd pick a muscle group, say your forehead, tense it for about 5 seconds, like raising your eyebrows really high. Then immediately release the tension completely and pause for 10 seconds, noticing the feeling of relaxation. Then you move on eyes, cheeks, jaw, neck, shoulders, arms, chest, legs, feet, working your way down.
So you focus on the contrast between tension and release.
Exactly. You focus on that feeling of the tension draining away, your body becoming heavy and relaxed. Often people fall asleep before they even finish scanning the whole body.
Interesting. Okay, what about slightly longer methods, the 120-second category?
There were a few interesting ones there. One is called paradoxical intention. This one sounds really counterintuitive.
Oh.
The idea is you actually try to stay awake.
Wait, what? How does that help you sleep?
It sounds bizarre, right? But the theory is that by intentionally trying to stay awake, you remove the pressure and anxiety associated with trying to fall asleep. You take away that performance anxiety we talked about.
Huh. Does it work?
The source mentioned some research suggesting it might actually reduce that sleep-related anxiety and improve how rested people feel, maybe even more than breathing exercises for some insomniacs. But also notes the research is pretty limited so far.
Definitely an unusual approach. What else is in that category?
Imagery distraction. Basically, using your imagination to visualize a calm, peaceful place instead of, say, counting sheep or focusing on your body.
So like daydreaming yourself to sleep?
Kind of, but more focused. The source mentioned a study from 2002 where people using imagery fell asleep faster than those just told to distract themselves. The key is to make the scene really vivid and engaging for your senses.
How so?
Don't just picture a beach. Imagine the feeling of the warm sand, the sound of the gentle waves, the smell of the salt air, the warmth of the sun. Really immerse yourself. The idea is to occupy your mind so fully with this peaceful scene that worries can't intrude.
That sounds quite pleasant, actually. And the last one mentioned was acupressure.
Yes. The source included this as another option, citing a 2019 review that suggested it might help reduce the time it takes to fall asleep and maybe improve sleep duration a bit, but again, emphasizing the research is limited. It described 3 specific points.
Tell me about those. Where do you press?
Okay, the first is called the spirit gate. It's on your wrist, on the pinky side, in that little hollow just below your palm at the crease. You apply gentle pressure there, maybe circular or up and down, for 2-3 minutes. Do both wrists.
Spirit gate. Okay. What's next?
The inner frontier gate, this one's also on the inner wrist, but come down about 3 finger widths from the crease, right between the 2 main tendons you can feel there. Apply steady pressure or, again, a gentle massage for a few minutes.
Got it. And the third?
The wind pool. These points are actually at the back of your head, at the base of your skull, kind of in the hollows where your neck muscles meet your skull. You can interlock your fingers behind your head, cradle it, and use your thumbs to apply deep, firm pressure there, maybe circular or up and down. Breathing deeply while doing this is recommended.
Interesting. So a real toolkit there, from body scans and breathing to mental tricks and even pressure points.
Definitely offers different avenues to try. But beyond these immediate techniques, the sources also dive deep into a key biological player in sleep regulation.
Ah, you must mean melatonin. That PubMed source went into a lot of detail.
It certainly did. Melatonin, as the source explains, is a hormone. It's produced mainly by the pineal gland in your brain and primarily at night. Its main job is to act as a time cue.
A time cue, like telling your body clock it's nighttime.
Exactly. It signals darkness to your central circadian clock, that's the SCN, the suprachiasmatic nucleus in the hypothalamus, and also to other parts of your body. This helps lock our internal 24-hour rhythms, especially the sleep-wake cycle, to the actual light-dark cycle outside. Bright light, conversely, shuts down melatonin production.
And does the signal directly make you sleepy?
Well, the source clarifies this. The big push towards sleepiness, that sharp increase in what we call sleep propensity, usually happens about 2 hours after your body starts releasing melatonin in the evening, so it's more of a preparation signal.
Okay, so taking melatonin isn't like taking a sleeping pill that just knocks you out cold.
That's a really crucial distinction the research makes. It's not a sedative in the same way a traditional hypnotic drug is. Its effect builds up over a couple of hours, much like the natural process. And its effects tend to be most noticeable when your own natural levels are low, like if you try to take it during the day, or for people who naturally produce less, which often happens as we get older.
How does it actually work in the brain to promote this transition to sleep?
The research suggests it acts in a couple of key ways. It works on that master clock, the SCN, to basically turn down the volume on the stay awake. Signals that the clock normally sends out during the day.
Okay, makes sense.
But interestingly, it also seems to affect other brain regions, particularly areas involved in the default mode network, or DMN.
The DMN, isn't that the network that's active when your mind is wandering, kind of daydreaming?
Exactly. That network is usually highly active when we're awake, but resting, and its activity decreases significantly when we fall asleep, especially in deep sleep. Melatonin seems to help quiet down activity in key parts of the DMN, like an area called the precuneus. This helps promote fatigue and shift the brain towards a more sleep-ready state.
So less about forcing sleep, more about signaling conditions are right for sleep now.
That seems to be a good way to put it. It facilitates the natural transition.
Okay, that's the biology. What about the clinical side? What does the evidence from that PubMed source say about actually using melatonin supplements?
It's quite compelling, especially for specific situations. For circadian rhythm disorders where the timing of sleep is off, it's very effective. Think of non-24-hour sleep-wake disorder, which often affects people who are totally blind. Melatonin helps sync up their internal rhythms.
Right, acting as that external time cue they lack from light.
Precisely. There's also strong evidence for delayed sleep phase syndrome, helping night owls shift their sleep earlier. And of course, it's widely used, based on good evidence, for managing jet lag and shift work adjustments.
What about for general insomnia, just trouble sleeping?
Here, the source distinguishes things a bit. It highlights that a major complaint, especially in older adults, isn't just falling asleep, but poor sleep quality, feeling unrestored even after sleeping. And as we mentioned, natural melatonin production often decreases with age, which likely contributes to this.
So does standard melatonin help with that?
Standard immediate-release melatonin does seem to help people fall asleep a bit faster, reduce sleep onset latency, as the studies call it. Meta-analyses support that. But the evidence hasn't been as consistent for improving other things, like how long you sleep or that feeling of restoration.
But there was that other formulation mentioned, prolonged release.
Yes, prolonged release melatonin, or PRM. This was specifically designed to mimic the body's natural overnight release pattern, sustaining levels for several hours. It's actually approved in Europe and other places as a first-line treatment for insomnia characterized by poor sleep quality, specifically in people aged 55 and older.
And what did the research show about PRM compared to the standard stuff?
The findings are quite significant. PRM was shown not just to help people fall asleep faster and improve their subjective sleep quality, but it also led to significant improvements in morning alertness and overall quality of life.
So that points towards more genuinely restorative sleep?
Exactly, that's the implication. Plus, it appears safe for long-term use in older adults, even those with other health issues. And importantly, it doesn't seem to disrupt the natural sleep architecture, the balance of sleep stages, like some traditional sleeping pills can.
That's a key difference.
It is. And interestingly, the source notes its effectiveness seems to build over time, sometimes taking up to 13 weeks to reach its full effect.
Any other groups where melatonin shows promise?
Yes. The source also mentioned growing evidence for its use in children with neurodevelopmental disorders, like autism. Sleep problems are unfortunately very common in these kids, often related to underlying circadian rhythm issues, and studies suggest melatonin can be quite effective.
Okay, this is all fascinating for sleep itself. But then the source went further, exploring potential links between melatonin, sleep, and, well, bigger health issues, disease modification.
This is where it gets really thought-provoking.
Yeah.
The research connects these dots between sleep, our internal rhythms, melatonin levels, and major health challenges like cardiovascular disease and even neurodegenerative diseases.
Okay, unpack that for us. Let's start with nocturnal blood pressure.
Right, so there's a strong link, it goes both ways, between poor sleep or insomnia and high blood pressure. Normally, your blood pressure should dip by about 10–20% while you sleep. If it doesn't dip properly, that's called non-dipping. Your risk of heart attacks and strokes goes up significantly, like 1.5 to 3 times higher.
Wow. And non-dipping is linked to sleep quality?
Yes, it's more common in older adults and clearly linked to poor sleep quality.
Yeah.
And some studies show that people with severe hypertension or non-dipping patterns often have lower nighttime melatonin levels.
So could melatonin treatment help?
Well, studies using that prolonged release melatonin, PRM, have shown it can actually reduce blood pressure in hypertensive patients, particularly nocturnal blood pressure. The reductions seen around 6 mmHg systolic and 4 mmHg diastolic overnight in one study are considered clinically meaningful. And again, unlike some sleep aids, it preserves deep sleep. The idea is that by improving restorative sleep, PRM might potentially improve cardiovascular outcomes, though more research is needed.
That's a huge potential connection. What about REM sleep behavior disorder, RBD?
Right, RBD. This is where people lose that normal muscle paralysis during REM sleep and physically act out their dreams, sometimes violently. It's quite distressing, but also it's often an early warning sign.
A warning sign for what?
For developing certain neurodegenerative diseases down the road, particularly those involving alpha-synuclein protein buildup, like Parkinson's disease. RBD can appear years, even decades, before the motor symptoms of Parkinson's emerge.
So treating the sleep disorder might actually be intervening early in a neurodegenerative process.
That's the really exciting possibility the source raises. There's emerging evidence that melatonin, often at higher doses, can be quite effective at managing the symptoms of RBD. Because RBD is linked so strongly to these future neurodegenerative risks, it offers a unique window to test whether improving sleep and perhaps melatonin function could actually modify the course of the underlying disease. It's a major area of research interest.
Incredible. And that ties into the final big connection, cognitive function and Alzheimer's disease.
Absolutely. We know sleep is critical for consolidating memories, right? And insufficient sleep clearly impairs cognitive performance. But the link goes deeper. The sources show a strong association between poor sleep, both quantity and quality, and a higher risk of developing cognitive decline and Alzheimer's later on. Poor sleep is also very common in people who already have mild cognitive impairment, MCI, or AD.
Does this connect back to that brain cleanup idea?
It seems to. The theory is that sleep disruption, especially loss of deep sleep, might impair the brain's waste clearance system, the lymphatic system. This system is thought to be most active during sleep and helps clear out potentially toxic proteins, including amyloid beta, the protein that forms plaques in Alzheimer's disease.
And amyloid often builds up in those DMN areas you mentioned earlier, like the precuneus.
Exactly. Those DMN regions, particularly the precuneus, are known to accumulate amyloid early in AD, and dysfunction there is linked to both poor sleep and cognitive decline. And remember, melatonin helps quiet down activity in the precuneus.
So could melatonin help protect against cognitive decline or AD?
That's the big question. Studies with standard melatonin in AD patients have had mixed results on objective sleep measures. But one promising study highlighted in the source used PRM, 2 milligram, for 6 months in patients with mild to moderate AD. It found improvements not only in their subjectively rated sleep quality, but also in their cognitive function. And these effects seem to strengthen over the study period.
That's potentially huge. Improving sleep might actually improve cognition in AD patients?
It's a very promising finding, whether it's directly due to melatonin's effects on brain receptors or because it's improving the overall restorative quality of sleep and thus maybe helping with amyloid clearance or reducing DMN hyperactivity, isn't fully clear yet. But the source concludes that melatonin's potential to improve restorative sleep, combined with these links to brain activity, protein clearance, and cognition, makes it a really important area for research aimed at promoting healthy brain aging and possibly intervening in AD.
Wow. It really elevates the importance of sleep from just feeling good to potentially influencing the course of major diseases. It feels almost negligent to ignore it now.
The connections drawn from the research are certainly powerful, yes. It really underscores sleep as a pillar of long-term health.
Okay, so we've gone deep into the biology, the problems, the techniques, the fascinating potential of melatonin. Let's bring it back home. Circle back to the absolute basics that both Healthline and Cleveland Clinic really emphasized. Sleep hygiene.
Yes, absolutely crucial. These are the foundational habits that create the right conditions for sleep. Often the first, and sometimes the most effective place to start.
So remind us, what are the core components of good sleep hygiene?
Consistency is probably number one. Going to bed and waking up around the same time every single day.
Yeah.
Yes, even on weekends, as much as possible. That really helps stabilize your internal clock.
Okay, consistency. What else?
Your sleep environment. It needs to be optimized for sleep. That means keeping it cool, dark, and quiet. Really minimize light and noise disruptions. Make sure your bed and pillows are comfortable.
And things you do during the day matter too, right?
Definitely. Getting enough natural sunlight exposure, especially earlier in the day, helps reinforce your circadian rhythm. Regular physical activity is also great for sleep, but generally best to avoid intense workouts too close to bedtime.
Right. And then there are the things to avoid, especially in the evening.
Yes, the usual suspects: caffeine, coffee, tea, soda, even chocolate. Ideally avoided for at least, say, 4 or 6 hours before bed, maybe longer if you're sensitive. Nicotine is a stimulant too. Alcohol might make you feel drowsy initially, but it disrupts sleep quality later in the night.
What about naps and meals?
Late afternoon naps, generally after 3 p.m., can interfere with your ability to fall asleep at night, and try to avoid very heavy meals or drinking large amounts of fluids right before bed.
Okay, so manage the inputs, light, activity, food, drink, and keep the schedule steady.
That's the core of it. And it's really important to add, if you've tried consistently applying good sleep hygiene, maybe tried some of those techniques we discussed, and you're still really struggling with sleep.
Time to call in the professionals.
Exactly. The sources strongly recommend talking to your doctor or a sleep specialist. There might be an underlying medical issue, a sleep disorder like apnea or RLS, that needs specific diagnosis and treatment.
What would a doctor typically do?
They'll usually start by asking detailed questions about your sleep habits, your health history, medications. They might ask you to keep a sleep diary for a couple of weeks to track your patterns, and in some cases, they might recommend an overnight sleep study, a polysomnogram, where they monitor your brain waves, breathing, heart rate, muscle activity while you sleep.
So the basics are key, but help is available if the basics aren't enough.
Absolutely. Sleep issues are complex, but there's a lot that can be understood and addressed.
This has been incredibly illuminating. We started asking why we need sleep and discovered it's this incredibly complex, active process. Intricate brain waves, hormone balancing, distinct stages vital for repair and function. It's clear that struggling with sleep is extremely common, but also that there are so many avenues to explore, from simple behavioral techniques to understanding the deep biological role of melatonin.
And those connections the sources revealed are just profound, aren't they? How sleep isn't just about feeling rested the next day, but it's deeply tied to your heart health, your brain function, maybe even playing a role in managing or delaying devastating conditions like Alzheimer's or Parkinson's via things like RBD. That idea of restorative sleep, it's not just a feeling, it's backed by real biology involving brain cleanup and keeping our internal rhythms synchronized.
It really makes you think twice about scrolling on your phone late at night or hitting snooze 5 times, doesn't it? Considering just how deeply sleep is woven into pretty much every aspect of our physical and mental health, here's a final thought for you, our listener. What's one small change, just one thing, you could realistically make to prioritize your sleep a little bit more this week? And what ripple effect might that seemingly small shift have on how you feel and function overall?